Tonight, I want to talk about our follow-up to last week's meeting. I also want to again thank Dr. Jean Zalezdik for their thorough presentation, answering questions. We got really positive feedback from their presentation. People, I think, learned a lot as well. It was truly educational, and I greatly appreciate their time, and they're willing to be so transparent and open with their thinking. So we are building on their recommendation, which they discussed thoroughly last week, to shift our testing from pool testing to antigen testing. And of course, the same day last Tuesday that they presented, the Department of Elementary and Secondary Education came out with their own testing program using antigen or rapid tests. And so just to reiterate the message that we heard from our doctors, the challenge with the pool testing or the PCR testing is that it does not provide the information that is needed by most schools. And what we need to identify infectious individuals and keep them home. That is the goal we want in our testing program. And the antigen test, which we'll talk about how we're going to roll that out momentarily, provides an indicator of infectiousness, which the PCR does not. And also, obviously, they spoke about the delays in getting the pool testing, which we've certainly seen, as well as the operational challenges in terms of getting the information from state labs. Therefore, based on the medical advisory's unanimous recommendation, we will be shifting our testing strategy from pool testing and toward at-home weekly rapid and antigen tests. Pool testing will continue for students and staff currently using the program, and that's our all staff and our pre-K to 6 students, and that will continue through the week of February 7th. And certainly by then we expect our at-home antigen testing program to be ready for implementation. While some families have had access to testing, this will now guarantee that all families have access to weekly testing at home. So I also want to stress that we will continue in-school symptomatic testing for students and staff that develop symptoms during the school day. What we will discontinue is the test and stay program, as well as contact tracing, which DESE has strongly recommended. Here are the highlights. All students and staff will need to opt in to the new testing program. We talked about that last week. There is no option to that. We did check. The previous consent form will not apply, and this will be done through Aspen, which is our student information system, as it is done in the fall. The take-home antigen test kit will be distributed at school every other week for all students who have opted into the program. That will give students 2 tests. We're going to recommend that all families conduct a rapid test on the Wednesday of each week, and only positive results will need to be reported to the school. Nurses will provide follow-up information to families, including the date for returning to school. I'll share all this information tomorrow morning with families. We will share it in multiple ways, and we will have more information on the implementation as we go. There's a webinar tomorrow, which our staff will be participating in with further information on the implementation. So that is where we're headed. I'm grateful to our medical advisory group. So this is a shift in testing based on their recommendation.